followed by Dr. Mark Escott, Chief Medical Officer, City of Austin, and Interim Austin-Travis County Health Authority, then Janet Pichette, Austin Public Health Chief Epidemiologist, followed by Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention and Health Promotion Division. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Adrienne, over to you.
Good morning. Pleasure to be here with you all today. My name is Adrienne Stirp, and I have the pleasure of serving as the Interim Director for Austin Public Health. This week has been a week of milestones. We are in a good place as a community with respect to managing COVID, but acknowledging that we still have more work to do. And in the coming weeks, you will see us change our strategy to have more of an equity focus. We will continue to work with our communities to reach out to those zip codes and areas where we're still seeing some disparities, but still remaining confident that we are on the right track to get towards herd immunity.
Dr. Escott.
Thank you and good morning. I want to start by first saying that earlier today I signed a notice transitioning the health authority rules issued on Tuesday into recommendations. As we're aware, the governor, about 2 hours following the issuance of those orders, issued an executive order himself, which created conflict between the two. Now's not the time for us to be in conflict. Now's the time for us to focus on the message. And the message is that unvaccinated people or partially vaccinated people need to wear a mask when they're out in public. Those who are unvaccinated need to get vaccinated. This is the best protection that we have right now. The data that we have for vaccinated people in Travis County indicate to us that 99.9% of them have not yet developed COVID-19 infection. That's incredibly good. This is much better than the best flu shot we've ever had. So right now we want to focus on that message that folks need to get vaccinated if they're unvaccinated. And if they are vaccinated, it is now time for them to be able to relax a little bit. There's still certain circumstances where folks should still mask, as outlined in those guidelines. And we look forward to our community continuing to embrace the keys to success which have worked so far. So far, Travis County has less than half of the death rate from COVID-19 as any other jurisdiction in the state of Texas in terms of major metropolitan areas. Less than half the rate of Texas as a whole, less than half the rate of the United States as a whole. Our transmission is lower than any other metropolitan area of Texas as well. This is because our community has worked together. They've continued to mask when others didn't. They've continued to distance when others didn't. They continue to stay home when they're sick and get tested. These are the things that have worked and will continue to work as we drive COVID-19 to zero. So with that, I will turn it over to Janet Pichette.
Good morning. I'll just add that, yes, as both Adrienne and Dr. Escott have mentioned, we are in a really good place now in Austin and Travis County and in Texas as a whole. And I do feel like we are on the road to recovery. And with that, I think what will happen is our focus will then begin to transition so that we look at variants that are circulating in our community. We're going to be focusing on reinfections and breakthrough disease following vaccination so that we can try to really understand, what's the best way to protect ourselves from here on out. The focus on clusters and now that the cases are low, our increase in case investigation and contact tracing will increase. With the goal of trying to stamp out this disease, we're going to try to figure out where those clusters are, where those hot spots might be, and try to tamp those down so that we don't have reignition of a surge. So, I think with variants that are circulating, we've recently heard that Dallas had the Indian variant, the variants from India identified, and those were identified in people with no travel history. Means that we have that variant in the state and it's circulating. It could very well be in our community, but we need to make sure that we continue to protect ourselves from those types of strain. One of the best ways to protect ourselves right now is to get vaccinated. Vaccines save lives, and we've seen that happen with how effective they've been in reducing the number of cases. So with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet. Want to just really commend the community on being willing to get out there and get the vaccine, get out there and make sure that as we're reopening, that you're continuing to be careful. And that speaking back to what Dr. Escott said, that really translates to how well we have fared throughout this entire pandemic and how we'll be able to fare moving through the next few months and ongoing years. With the new Pfizer expanded population that's eligible for that vaccine and is appropriate for the Pfizer vaccine, we have seen some good uptake. Almost 9,000 children between the ages of 12 to 15 have at least gotten one dose of Pfizer. And so that really is very encouraging, noting that that's only been available for about a week. So we really want to encourage parents and families and anyone who hasn't gotten vaccinated to go ahead and get the vaccine. It's available in many, many locations. If you get your vaccine from Austin Public Health, you can walk up to any of our locations. We encourage you to call 301 just to find out what the hours are and where we're operating. But you can go to any location, request your vaccine. It's free. You don't have to show any ID. You don't have to prove insurance. It should be as easy as anything else to get your vaccine. Also, just to kind of piggyback on what Director Stirrup said, we are really looking to right-size the vaccine intervention. We know that really taking the vaccine where people are, where people live, where people can access is really the key right now to make sure that there's absolutely no barrier and people have a lot of resources available to them. So we'll be looking in the next few weeks and working with our partners to really make sure that wherever the vaccine can be of help and needs to be provided, that we're there and we're providing that to the greater community. With that, I'll open us up for questions.
Thank you, Cassandra. At this time, we will now go to our pool reporter, Sangeeta Menon from KUT. Sangeeta?
The first question is from KUT. How is the new community-based approach for vaccine distribution going? How many events have been held and how many people have been vaccinated at those events?
I'll jump in. They've actually been going really well. We are connected from Austin Public Health's perspective. We've provided quite a few events. Starting in March was really when we started partnering with faith-based organizations and many other groups to really connect to provide vaccine. And there's many planned. We usually have about 2 to 3 per week that we pop up, but we also have had a mobile vaccine team that's been working since February to go to many, many different locations, and they are usually hitting 3 different locations per day throughout the week. So there's quite a few that we've done, and we definitely are seeing that this is the time to really mobilize and really expedite those different types of operations to any place we can across the community.
The next question is from the...
No, go ahead, Adrian.
All right, I just wanted to jump in real quick and add on to what Cassie shared. I believe our mobile outreach team has provided over 5,000 vaccinations thus far. And this week, we will be at the Sacred Heart Church on Friday and Saturday. We'll be at Del Valley High School on Saturday, and that is in partnership with Travis County. And then on Sunday, weather permitting, we'll be having an LGBTQ+ event in collaboration with many partners that service that community at Gibbons Park. And so we are really, you know, digging our teeth and our heels into this community-based approach to make sure that we leave no stone unturned and that everyone who wants a vaccine has that equitable access. Thank you.
The next question is from the Austin American Statesman. Can businesses legally require proof of vaccination for customers? What laws allow or prevent them from doing so?
I'm happy to address that one. First, let me say I'm not a lawyer, so it's important to consult your attorneys on this question in particular. However, when we look at the privacy of medical information, that privacy is the information the person has, okay? So if an individual chooses to share their vaccination status with someone else, a business owner, as a condition of entry, there's not a privacy issue because the owner of that information is sharing it. Certainly, the information that we've seen so far indicate that a business can ask for proof of vaccination for entry into a private space, which is their business. So, you know, it is unlikely that we're going to see that to a large extent, but there are some places, as I discussed on Tuesday, that may be more inclined to want certainty about entry without masking. For instance, hair salons, where an individual may be in the hair salon for several hours at a time, face-to-face without mask on. This is a high-risk circumstance. In that kind of circumstance, individual may want more proof than someone's word. But again, it's important for those businesses to consult for legal advice when they're developing their policies. I also want to mention that the governor has been very clear throughout this pandemic, and that is businesses have the right to determine the conditions of entry. So if a business has a mask required sign, masks are required as a condition of entry. If somebody enters without a mask on, they're trespassing and can be asked to leave. This is the right of a business owner, and certainly we expect here locally that people will respect that, and that many businesses will choose to continue masking in the short term.
The next question is from KXAN. Last update, Dr. Escott said, if you had COVID, you still need to get vaccinated. Some people question that. Can you expand on why it's important?
The evidence that we have right now is that the protection from the COVID vaccine is more comprehensive than having the disease itself. When we look at the reinfection rate versus the breakthrough infection rate, so you've been fully vaccinated and get infected, the reinfection rate for COVID-19 is about 20 times higher than it is for breakthrough infections. Again, right now, the data that we have in hand is that 99.9% of people who've been vaccinated have not been infected with COVID after they were fully vaccinated. It's incredibly powerful vaccine. It's an incredibly safe vaccine. So we encourage all members of our community, even the ones who've had COVID, to get the shot. I think as we go through the summer and we see EUAs lifted and full approval granted for many of these vaccines, we're also likely to see institutions starting to require them. So schools, universities, and some businesses as well.
The next question is from CBS Austin. Do you think the change in masking policy will have a significant impact on Austin's ability to reach herd immunity? The previous relaxation of masking rules by Governor Abbott did not seem to negatively impact reducing cases.
Well, my concern is, and I agree, the cases have continued to drop. However, you'll notice that we've had dropping and then plateau and then dropping and then plateau. Our concern is that that we're going to see a prolonged tail on this pandemic here in Texas. When we look at the data of Travis County active cases per 100 population versus the rest of the state, the number of cases per 100 residents is 4 to 5 times higher outside of Travis County as compared to inside Travis County. The same is true when we look at Travis County versus the other counties in the MSA. 4.5 times higher active cases as compared to Travis County. To me, that's evidence that that masking policy works. And that's why we continue to encourage our businesses, our community members, particularly those who are unvaccinated or partially vaccinated, to continue masking until we can reach a better place of herd immunity.
The next question is from Community Impact. In the past, local authorities have pushed back on Governor Abbott's orders banning mask mandates from local officials. Why not now?
So, again, when we engage in battle between the city and the state, the message becomes about the battle and not about the message. And the message that we want people to hear is that if you're vaccinated completely, then you're relatively safe. Again, 99.9% of folks who've been vaccinated have not gone on to develop COVID-19 so far. However, those who are unvaccinated or partially vaccinated need to continue to protect themselves when they're out in public. This is the message that the CDC shared a week ago. And somehow we transition from that message into this perception that masking is optional for the entire country. That's not at all what the CDC said. What they said is for vaccinated people, you can move around relatively freely, except for certain circumstances where vulnerability is much higher. Unvaccinated people, partially vaccinated people, should still wear masks. That piece of the message has been lost in the past week, and we want to bring that message back to the forefront. I also want to say we're grateful for the state. We're grateful for the governor and what they've done to support Austin and Travis County throughout the past year. The governor's issuing of a mask mandate back in June, when it was a very, very unpopular thing to do for a Republican governor, but he did it anyway because he knew that he needed to protect Texans. And the result has been thousands of lives saved because of that decision. We've had support from the Texas Division of Emergency Management, from DSHS, in our Regional Infusion Center, in our Austin Convention Center, which was our alternate care site, and a number of other initiatives. The state has come in to support this community, including healthcare personnel for all of our area hospitals. So I don't want to vilify the state. We have worked together with the state throughout this pandemic. Yes, there is a disagreement on what that policy should be, but we want the message heard. And I think by avoiding a prolonged legal battle, we can focus our efforts on the battle in front of us, which is ensuring that folks are vaccinated and ensuring that the message is heard.
And I'll add what I said earlier in my opening remarks, and that is what we have seen is that vaccines save lives. And, I think, as Dr. Escott mentioned, I think the goal here for all of us is to get as many people vaccinated as possible, try to break down the barriers and break down the reason why people are hesitant to receive that vaccine. I think we all want to get back to normal, and I think one of the key ways to do it is to get vaccinated. And if you're not vaccinated, or if you feel unsure about going out in public, you can always still wear your mask. That's, a level of protection. And, I think people need to be respectful and mindful that there are reasons why people choose to do their masking in public places. It could be to protect a loved one. But again, vaccinations have been key in our response.
The next question is from KOOP Radio. How concerned are you about the 2 cases of the India variant in North Texas? In the past, you have stated that if a variant is in the US or the state, it is also here.
I am concerned about that. Obviously, viruses don't like to stay the same. They like to mutate. They like to change their configuration to try to outsmart the host. And so I think the variant from India being on our horizon in our state is concerning, and we will be watching it very closely. Of concern, based on the information I've received, is that these cases are not in people who have a travel history anywhere. So to me, that means that it's out in the community, and so once you have it in the community, we can begin to see it spread within the community if people aren't careful. So, that's one reason why we are trying to refocus our epidemiologic response efforts on looking at variant surveillance and trying to get some of these samples sequenced to identify what variants are circulating in our community. It's kind of the thing we do, whether it be flu or coronavirus now. The better and more quickly we can identify something, the faster we can squash that disease and keep it at bay, and prevent clusters and outbreaks from occurring. So we are concerned.
Let me also just add, I think the situation in India is a reminder to us as a community, as a country, that our duty doesn't stop with vaccinating the United States. We have to work hard to vaccinate the rest of the planet. We're going to see new variants emerge in places like India, places like Mexico City, Sao Paulo, Lagos, Nigeria. These densely populated places are where we're going to see variants emerge. And as the variants continue to become more competitive, we risk the development of a variant that eludes the current vaccine. So again, we need to work quickly to get our community vaccinated so that we can pivot to those areas of the planet that are struggling with their vaccination effort.
The next question is from the Austin American Statesman. Has Austin Public Health had any coronavirus vaccines go to waste in recent weeks because of a decrease in demand? If so, how many?
I'll jump in and respond. So I think it's really important to think about the COVID vaccine clinics and the process. And then also there's waste that's involved with COVID vaccine clinics. And then there's also areas that we have to track to make sure we don't have vaccine loss. And it's 2 different considerations. Vaccine loss is when we have vaccine that's been stored in a storage facility, a refrigeration or freezer, and for some reason that vaccine becomes unviable, meaning that it either was out of temperature for a certain period of time or it expired. Austin Public Health has had no incidences of that occurring. So I think that's really important that we've really been tracking our vaccine inventory to make sure it's appropriate for the population that we're serving in, for the gauging to see if the population demand dwindles, that we're able to utilize all of the vaccine that we have and not risk any expiration. We've also been able to help other cities to transfer vaccine from them to us because they had some risk of vaccine potentially expire. And we've been able to integrate them into those vaccines into our operations so that there's no loss and we can support the larger statewide effort. Vaccine waste at a clinical effort does happen from time to time, and particularly when we have mass large clinics. Vaccine waste will occur from mechanical failure, from syringes, from potential contamination that might happen to the needle. And those things can happen daily at a clinic, and typically is something that we do anticipate while it is few, usually it's under 5 or so per clinic, it is something that we do take very seriously. On the other piece where we draw vaccine and we don't have enough individuals to come to the clinic, we work with our other clinics across the city to try to push that vaccine to another location so that we can find arms to put the vaccine in to minimize as much waste as possible if there's just not someone to provide the vaccine to. That being said, we really are encouraged that the Department of State Health Services has eased some on if you have an arm and you haven't opened up a new vial, go ahead and do that, because vaccinating that one person, providing them with that protection is much more precious and much more important in protecting that individual and the community than potentially wasting additional vaccine because we didn't have additional arms to provide to. So we really work towards that. We work very hard not to waste any vaccine, but as we see less and less demand for vaccine, our first priority is going to be to make sure we vaccinate anyone who is willing and ready to get that vaccine and not let the fact that some vaccine may go to waste be a barrier to them getting the vaccine.
The next question is from KXAN. What's your biggest challenge right now as Austin Public Health?
I'll be happy to start that. I think the biggest challenge at this stage is the threat of a long tail towards herd immunity. It's getting that last percentage of our population vaccinated. We've done a great job. We're significantly higher in terms of vaccination rates than the state of Texas. And we're happy that our community has been engaged in getting vaccinated. But we've got more work to do. As the school year ends, as summer begins, as people get the sense that things are better, because they are, we also risk the fact that they may be less inclined to get the vaccine. It's important that we continue those efforts. We continue sharing the efficacy and the safety information related to vaccines so that we can truly get to herd immunity and drive those case numbers down to 0.
And I'll add that, I think we're at a point now where we are trying to right size our operations to make sure that as we devolve some services, whether it be testing or vaccine operations, transition to a more community and mobile approach, there is still a lot of, from the outside, it may look like our work is over, but it really in reality is not. We are continuing to work. You have a strong public health workforce that continues to do case investigations and track down outbreaks and clusters and ensure that our community is safe. If we identify people, making sure they get into quarantine or isolation so that we can, we can get this behind us. We're working very hard on evaluating and assisting those who are beginning to reintegrate back into the workforce and making sure they understand the best way to protect their workforce as well. But there's a lot of work that will continue, as Dr. Escott says, as this tail continues to trail out. We still are doing a lot of work that may go unnoticed.
Thanks, Janet. And I'll just jump in there and kind of piggyback off of what you and Dr. Escott just shared. When I think about our next biggest challenge, it really is systemic distrust in healthcare in our historically marginalized populations. And unfortunately, that's where we are seeing the greatest disparities with respect to vaccine uptake. And so, every day we are working with our community partners and internally with leadership to, as Cassie said, right size our operations so that we are meeting those needs. There's a sense of sensitivity with which we have to approach that because that hesitancy comes from historic mistrust and misuse in those communities, and how we approach that and how we work together with them to get over this last hump will be important. Thank you.
The last question is from KOOP Radio. With the real potential that many unvaccinated will likely remain so, will it be possible to reach herd immunity over a much longer time as they are exposed and therefore being vaccinated through exposure to the virus?
Again, I think there's danger in that approach because we know that the reinfection rates are much higher than the breakthrough infection rates. And, again, the concern that we have regarding over relaxation of policy right now is that you allow COVID-19 to fester for longer. Now's the opportunity to chop the head off the snake. It's now the opportunity to kill it. And if we maintain the vigilance a little bit longer, if we continue a hard push on vaccinations, if we continue to support masking by unvaccinated people, by people in public transit methods, in large gatherings, then we can cut the head off the snake. Otherwise, this may fester for a very long time. I think we're all best served by ending COVID-19 now. So our hope is that our community will come together, continue to encourage one another to get vaccinated, and to continue to support masking for unvaccinated folks.
Thank you, Dr. Escott. Thank you, Sangeeta. We will now move into our closing remarks. We will start with Director Adrienne Stirrup first. Adrienne?
Thank you. As I listened to the conversation that we had today, I'm struck by what that really, if you boil down all of the data and the measures of success, it really speaks to the strength of our community. This is not something that was done to us or for us. This is something that we decided, and we still have the power of that decision. So you can decide to wear your mask if that's where you're comfortable. You can decide to get vaccinated, and you can decide to support others in that effort. So as long as we keep making good decisions, I am confident that we will get to where we need to be. I would be remiss if I did not acknowledge that part of the ability for our community to come together is having access to good information and sound advice. And so I'd like to thank Dr. Escott for his service over these long months. You have been the voice of reason in many conversations for us internally as a city, and I know for our community. And so I just thank you.
Thank you, Adrienne. And this is my last press briefing, so I again appreciate the partnership with all of you, but with our media as well. I appreciate the approach that you all have taken, and I think it certainly has been part of our success has been that interaction with the media. So my many thanks for that. People ask about masking and distancing, and is it too burdensome and does it work? It has worked. Our case fatality rate is amongst the lowest of any city in the United States. People ask, well, what about the economic impact? Our unemployment rate is among the lowest in the United States. What that tells me is that we found the right balance. And if we continue that balance, if we continue the push for vaccinations, if we continue to mask in public places for people who are unvaccinated or partially vaccinated a little bit longer, we're talking about another 2 to 4 weeks, we can kill the snake. We can end the COVID-19 pandemic, and we can all get back to normal. Yes, there's going to be some ongoing risk for young school-age children, but for adults, individuals 12 and older, we're talking about a very quick progression to 0 cases. So I hope that our community will continue to stay in the fight. I hope that we will continue to be a model for other cities in the United States. And I hope that once we get past COVID here, that sense of community will transition to supporting the effort across the globe, which is much needed for us to really conquer COVID-19. With that, I will turn over to Janet Pichette.
Thanks, and I too would like to thank Dr. Escott. He's been a rock for us here at Austin Public Health, and we have valued his experience and his decision making. And you know, there were a lot of hurdles that we had to overcome over the last year and a half. So I've appreciated that he has been here for us and been that support for us. And with that, you know, we are on our road to recovery, and, you know, we will continue to maintain our public health epidemiologic operations to make sure that we are getting the best information we can about what's circulating in our community, so that we can, again, tamp out COVID for good. And, you know, again, you know, vaccines are saving lives. It's important that if you have any reservations, that you educate yourself and try to get vaccinated, if not for yourself, for someone who may be in your family or somebody who's immunocompromised that you may encounter. You know, we all want to get back to normal, and I think that's one of the best ways to do it. And if, as Adrian mentioned earlier, if you want to wear a mask, wear your mask. I plan on wearing my mask still when I go out, because I have a loved one at home who I'm trying to protect and continue to protect. So, you know, again, I encourage people, strongly encourage them to get vaccinated so that we can get back to Austin being as weird as possible, I guess.
And I just have to echo both Director Stirrup and Janet's really words of thanks to Dr. Escott. He's been a cornerstone in this entire response and been so important in just leading our local effort. And it was a ask that came at a time where we didn't have a health director at Director Health Authority, and he was willing to step up and took it, and has been an incredible leader. And just to thank him for his incredible leadership during this time. And as we look into this next weekend, and as we look to the summer, I just, again, echoing everyone else, saying, please get your vaccine, please do your research. Know that vaccine is readily available in lots of different outlets. You can get it on the weekend, you can get it in the evening, you can get it in the morning. There's just so many places you can get your vaccine. So please check it out. See, your church may be offering it, your school may be offering it, just your business, your place of work, there's vaccine in lots of different places. So please check to see where you can get your vaccine. It's free. You don't have to provide insurance. You don't have to show any ID. You just need to go get that vaccine. And I wish you a happy, great weekend. And let's all just keep taking care of each other. Thank you, Austin.
Thank you, Cassandra. That concludes our media availability for today.